Hello, my name is Beth Kiss. I am the adult specialist within the Golisano-Institute for Developmental Disability Nursing. I also am an associate professor at the Wegman School of Nursing at St. John Fisher College, and I'm a family nurse practitioner at Strong Memorial Hospital in upstate New York, which is a magnet designated hospital. And I'm here to talk to you today about the chain of infection. This is a series of modules put together by Dr. Amy Jerem and I, and they're intended for direct support persons or family members of persons with disabilities. The first of these modules is going to talk to you about the chain of infection and ways that you can help stop the spread of infection. So the learning objectives for this talk include, first, to identify examples of how to prevent infection for elements of the chain of infection. Second, to explain the relationship between the chain of infection and the transmission of infection. And third, to understand the steps to take to limit the exposure of infection. I have some glossary of terms here to help familiarize yourself with the key terms that we're going to be discussing today. The first is bladder catheterization, and this is the process of inserting a catheter into the bladder through the urethra. And this is something that is a high risk for spreading infection. Hand hygiene, and that's just simply washing your hands. So sometimes we refer to that as hand hygiene. There's two types. The first is using soap and water. And we use soap and water when we see that our hands are visibly soiled. So we have stuff that's on our hands that we need to get off. The other time that we use soap and water is for certain diseases. So there's certain diseases that we say we can't use hand sanitizer for it. We have to wash our hands. The other one is, and there's an amount of time that we need to do that. So we need to wash our hands for a minimum of 20 seconds using soap and water. The other that you've heard is hand sanitizer, and that's alcohol-based waterless antiseptics. Personal protective equipment, otherwise known as PPE. These are tools healthcare providers use to keep themselves safe when working with patients. This could be a gown. It could be a plastic gown. It could be a mask that you put on. It could be goggles that you put on. It could be gloves. So there's things that you use to stop infection from getting on you or in you. All right. And social distancing. This is staying at least 6 feet away from others. All right. So these are terms that we use to refer to illness. It's important to keep in mind that there are many terms people use to refer to illness, and those can be used interchangeably. So the same chain of infection will apply to all of these terms when we're talking about the chain of infection. So sick, ill, viruses, germs, bacterial infection, those are all terms that people use, and they can refer to illnesses in the same way. You've also may have heard people refer to something called a community-acquired illness. A community-acquired illness is an illness that you get from being out in the community, as opposed to an illness that you get from being in a hospital environment. All right, and that could be the common cold, that could be the flu, influenza, RSV you may have heard of, and that's a respiratory virus, and then pneumonia, okay? All right, so let's talk about this chain of infection. What is this? Well, the chain of infection is the pathway that a germ or a virus takes to move from one person, or a person could be known as a host, to another. Understanding this process can help you and others work to identify the best ways to break the chain of infection and stop the spread of germs and viruses. So let's look at each link in the chain. The first is the agent, right at the top here. This is known as germs or bacteria, viruses, or parasites. So that's that thing that's out there that can get into you to cause an illness. The next chain is where germs live. This is also known as the reservoir. So germs can live in people or on things such as animals, pets, food, soil, water, okay? The next link in the chain of infection is how germs get out. This is known as the portal of exit. So germs can escape in many ways. It can include the mouth, such as vomit or saliva, cuts, such as skin or blood, during diapering, during toileting, so it can be in school. The next chain in the link is how germs get around. That's known as the mode of transmission. So germs get around from one place to another in many ways. It can include contact from hands, toys, it can be in sand, it can be in droplets. And you've probably heard of that because of COVID right now. So when you speak, when you sneeze, when you cough, it can travel in the air in a droplet. It also can be in the air for longer if you have something called an airborne infection, where it can live in the air for a very long period of time. Okay, how germs get in. This is called the portal of entry. So germs can get into our bodies in many ways, including our mouth. It can get in through cuts that we have on our skin. It can also get in through our eyes. And then who is our next susceptible host? And that's the next sick person. So some people who are at higher risk for being the next sick person can include very, very young people, such as babies, very, very old people, such as elderly, children, people with a weakened immune system, such as those who are already sick, or those who are something called as immunocompromised, or people who are not immunized, okay? So people who don't have their vaccination. So I have a video here that I want to show you about the chain of infection. So let's talk a little bit more about how we can stop the chain at each of the pieces. All right, so reservoir, where germs live. So the first thing we can do is separate personal items. So hygiene products should not be shared, and they may be dedicated to certain patient care equipment. So you may have a blood pressure cuff that stays with a certain patient. You may have a thermometer that stays in that patient's room. So that you're not sharing things among people within a home. The other thing is proper disposal of waste. So don't leave dirty tissues lying around, throw them out in the garbage, make sure that garbage has a lid, and empty that garbage regularly. And then social distancing. So that's restriction of visitors that are sick, okay? And if you have someone who is sick, making sure that they're staying at a good distance, at least at 6 feet away from others. The next step is the portal of exit. So remember, that's how germs or viruses get out. So they can escape from your mouth when you cough. So taking some simple steps can help germs and viruses from landing on surfaces. So that could be covering your nose or mouth with a tissue when you cough and promptly disposing of that contaminated tissue. Placing a surgical mask on a patient if it doesn't compromise their respiratory function. Performing hand hygiene after you come in contact with contaminated respiratory secretions, and maintaining spatial separation greater than 6 feet from people with any respiratory infection. And that's that social distancing again. The next step is the mode of transmission. So that's how those germs or viruses move. So when we think about how viruses get from one place to another, it can happen through direct contact by touching a person, or indirect contact by touching an item that a germ or virus has landed on. It can also be that you breathe in through the air. So large droplets can travel 3 to 6 feet and are generated by coughing or sneezing. Airborne infections generally are generated by coughing or sneezing, but they can stay in the air much longer and can travel through ventilation systems and move much farther. And animals and insects can also carry diseases and can also be a mode of transmission. So how do we protect ourselves from this? Well, cleaning surfaces often are one way. So high touch areas like doorknobs and countertops that we touch often, cleaning that with an antiseptic material would be one way that we could stop the spread of infection. Another way would be that when we are in large groups of people, to wear surgical masks, okay? And then if there is somebody that is displaying signs and symptoms of infection, making sure that we're maintaining that social distancing. What about the entry sites? So how the germs or viruses get in. So they're non-intact skin, mucous membranes like our mouths, our eyes, our noses, and our genitourinary tracts, okay? So ways germs and viruses can get in are through eating food with germs or viruses on them, bladder catheterization. So remember, that was one of our key terms, that putting that bladder into the urethra, touching our mouths, eyes, or nose when we have germs or viruses on them, or breathing in the germs or viruses. So eating foods with germs on them. One thing that we could do is not share our food. So when we are eating foods, keeping them separate and not doing a group dining situation where we're all taking food from the same bowl. Another thing that we could do is with the bladder catheterization that we discussed, making sure that you are using the proper sterile procedure for bladder catheterization. And with bladder catheterization, we always say in nursing, we need to make sure that there's an actual need for that catheter. So really evaluating daily do we need this Foley catheter? Should we still have this bladder catheter in this patient? Because if there's really not a need for it, we need to get it out. Touching our mouths, eyes, and noses when we have germs or viruses on our hands, really trying to be cognizant of being careful about touching our eyes and mouths, but also maintaining good hand hygiene. Washing our hands often, using hand sanitizer often is going to be a way that we're going to prevent that spread of the virus or bacteria to us, okay? And the breathing in the germs or viruses, like we talked about before, using that surgical mask when you're in a group setting with lots of people. Our next we're going to talk about is limiting the exposure. So how germs and viruses can enter the facility. One way that we can do this is cancel elective procedures. If a procedure isn't necessary right now, especially during times when someone is sick or we have a pandemic going on, such as COVID, we're going to cancel anything elective. Use telemedicine when possible, especially if you have someone who is sick or someone who is immunocompromised. What does immunocompromised mean? Immunocompromised means that they have a lower immune system. So they have a lot of risk factors that make them more susceptible to viruses or bacteria or not being able to fight off an infection. And that is many people who have disabilities. Many of them are immunocompromised. Limit the points of entry and manage visitors, especially in group home settings, when there are lots of people that come and visit at once. So screen the people that are coming in, take their temperature, make sure that you're asking questions such as, have you been out of the country? Have you been in contact with other people who are sick? Maybe you have only 1 to 2 visitors in the home at one time. So you're not having a bunch of people in the house at one time. Make sure there's no respiratory symptoms going on. Frequent hand washing. So before they come into the house, make sure they're using hand sanitizer. And encourage resident respiratory hygiene. So using the tissues to cover their cough. So what are some actions to limit the exposure? Some of the following actions can promote safety for residents' well-being, as well as prevent personal protective equipment and supplies, and expand the available hospital capacity. So reschedule the elective non-urgent healthcare visits, and we talked a little bit about that before. Postpone routine dental and eye care visits. Residents should avoid going to the hospital or outpatient care settings, such as urgent care, except as directed by a medical provider. Limit anyone who is not essential for care from entering all care areas, such as the medication room or the bedrooms in a group home setting. Restrict visitors that we talked about and minimize variation in contact. So maintain consistent pairing of staff with residents in a group home, and whenever possible, maintain a degree of social distancing in the residence or the facility. So when you are going into work, what are some of the things that you can do to keep yourself and the residents that you work with safe? And you should post this information on every door. So coming into work, wash your hands thoroughly and use hand sanitizer immediately. Remove your home or street clothes and put on your work clothes. Place your clothes in a bag and seal them. Place the bag in a secure location and consider keeping an extra change of clothing at work. When you're leaving work, you're going to wash your hands thoroughly and or use hand sanitizer immediately. So the minute you walk out of the resident facility, remove your work clothes, place them on the floor, wash your hands again and use hand sanitizer, put your own clothing back on, okay, and place the work clothes in a bag and seal it. When you are arriving home, as soon as you enter your home, your home care facility, Use hand sanitizer. As soon as you arrive home, wash your hands thoroughly and use your hand sanitizer, and shower as needed. Okay. Following these simple steps can help stop the spread of infection.